Okay, good morning once again, everyone, and welcome to this session. So in this session, I have with me a panel to present on the findings of the study titled "The State of Social Protection in the Context of COVID-19 in SADC." So the study wouldn't have been possible without the support, the financial support of the Open Society Initiative for Southern Africa. I think it's popularly known as, maybe from its abbreviation, as OSISA. We also thank Frederick Ebert-Stiefstang for the support and the great coordination of the SASPEN Secretariat in form of Susan and Naka. So here with me, I have David, who is joining us online. David was our country researcher in the study, and he brings with him enormous experience into this project, having joined the Namibian Social Security Commission some time back in 1995, and he has since served there in various capacities, including as a research manager. He's currently the general manager of operations at the SSC in Namibia. I also have with me here present Zakhe. So Zakhe is or was our Eswatini country researcher, and Zakhe is well known for her advocacy for women empowerment and the girl-child rights. Currently, she's the independent consultant and has done quite a number of work for organizations locally, regionally, and internationally. Then the third person to join me really is Isaac. Isaac couldn't come, and he's joining from Zambia, and he was the country researcher in Zambia. Isaac currently works for the University of Zambia as a postgraduate and undergraduate lecturer. He is also a senior research fellow at the Social Protection Champions for Zambia and Africa, as well as in the Center for Poverty Reduction and Research, also in Zambia. And then lastly, I'm joined by Mutale, so it's last but not least. And Mutale was the co-principal investigator of this project, and she is a seasoned social protection expert with over 10 years of experience in this field. So currently, she's the Group Chief Executive Officer of the Institute for Social Policy in Africa, which now has representation in 4 African countries. So this is the panel today. We've been instructed to save on time. We are really behind time. So what I'm going to do, I think I'll kickstart this session by posing them 2 questions each. And I'll pose them at one go to save time, and perhaps I'll give a maximum of 7 minutes for this discussion. And I'll kickstart it perhaps with David, so that he may tell us on the social protection responses to COVID-19 in Namibia, and how these responses basically compare to social assistance that has always existed. So David, if you can come through and speak to that relating to the research that you did in Namibia. Thank you.
Thank you, Dr. Gift. I would switch off my video. I just wanted to greet the conference delegates and indicate that I'm with you. In terms of the questions that have been put to me, I need to respond briefly as follows. But before I do that, it was my wish to attend this conference in person. However, we are living in extraordinary times. Greetings to you all colleagues and friends, especially the old friends of SASPEN. When I think of this conference theme and try to link it to the AU Agenda 2063, the Africa we want, I really associate myself with it. I'm tempted to think who of us will be there to see the seed we are planting today, especially on the social protection floor. For the records, I shall be 101 years in 2063. There's a big possibility that I shall be alive then. Please do your own calculation and make an appointment with me so that we can check whether what we are talking today will come to fruition in 2063. To answer your question, Doctor, I first want to start off by thanking the OSISA project 20 to 2021, in which I was the researcher for Namibia. We gathered useful evidence from this research, and there were important lessons that we learned too. I shall then be brief in response to your question, just to save on the time lost so far. The first thing I need to highlight is simply Namibia have no statutory unemployment scheme, and COVID-19 does find the country ill-prepared to deal with the pandemic. The social insurance schemes that are run by the Social Security Commission, SSC for short, only covers short-term coverage for maternity, sickness, and employment injury benefits. However, the Ministry of Finance, which is the custodian of government payers, through the Ministry of Finance, Honorable Ipumbu Shimi, issued the first phase of economic stimulus in the relief package on 1st April 2020, in collaboration with other key stakeholders, including the Social Security Commission. Private sector also came on board, development partners and other non-state actors. So in total, a package amounting to 8.1 billion Namibian dollar, which is equivalent to SA rand, back to one-on-one on SA rand, of which 5.9 billion was in direct support to businesses, households, and cash flows, acceleration payments for services rendered to government, and 2.3 billion related to off-balance sheet government liabilities were then introduced. 3 programs were designed to deal with the stimulus support during the pandemic, and this way, number 1, the emergency income grant. That was the first one. I'll just explain it briefly afterwards. The second one was the employer wage subsidy. And then the third one was the affected employee program. So these programs, we analyzed them during the research just to see how did they assist the affected people in terms of the design. So I'll just briefly explain how each one of these 3 were designed and how they would help the employee to, or the persons that are affected during the pandemic. On the first program, which we call IEG, or Emergency Income Grant, the government will provide a once-off payment of 750 Namibian dollars to employees and persons who have lost their jobs during the pandemic in the formal and informal sector. This also happened to go to those who were unemployed, but they were between the ages of 18 to 60, and who could not secure any employment during the period, but they were not students, and then they were not recipient of any social grants that are paid by government. Payments were made via cell phones of the beneficiary after successful assessment of an online application. And the use of cell phone was the main feature of the administration of this program. I'll, when I conclude, just indicate how successful that program was. The second program that was then introduced was the employer wage subsidy program for the hard-hit industries or sectors. And 3 sectors were identified by the Ministry of Finance to get benefit from this as a cash injection to support employers to carry their wages and salaries during the pandemic. These were the aviation, tourism, stroke hospitality, and then the construction. This program was designed to save jobs, and it targeted a wage subsidy to the amount of 400 million. The SSC provided additional funding in addition to these 3 sectors, but the SSC felt that they need to add more sectors, and they added 6 more sectors to the program for employers to qualify for a wage subsidy. The aim was to avoid further retrenchment in these sectors and to subsidize employers to retain their employees. Then the third program was the Affected Employee Program, which was meant for employed persons who were registered with the SSC, the Social Security Commission, to apply for a grant designed to provide for compensation for those, especially low-income earners who have lost income during the pandemic. This program was designed to provide a safety net for those who have been adversely impacted by COVID-19. The program was designed potentially to assist about 8,000 employers, employing some 65,000 employees who were then earning the income threshold below a 50,000 Namibia dollar per annum. So the others were excluded. So you could see that there was quite a huge chunk of people who were middle and high income were excluded, even if they were also impacted. So the benefit were only limited to 50% of the monthly salary, subject to a minimum of 1,000, and for a period of 3 months. And the benefit would be netted off if other benefits were received, like for emergency income grant. So using these parameters, there was then a budget allocation of 350 million that could cater between 56,000 to 117,000 applicants. Now, I need to come to see how did it fare then in terms of the execution of this program. In terms of the emergency income grant, the program received about 327,000 applications, but paid only less than half, which is 146,000 beneficiaries were paid out 750 for each applicant, and rejected about 180,000 applications due to different reasons, e.g. not meeting the criteria or some fraudulent applications that were submitted. In terms of the other program for employer wage subsidy and the affected employee program, for which an amount of 150 million and 350 million was budgeted, the outcome from those 2 programs, there were less than 30% success rate in terms of the payment, if we just look at the budget amount. So only a third of those amounts were able to be paid, meaning that there were a lot of exclusion. Now, in terms of then question 2, that I just wanted to conclude with is, how do this response then compare to social assistance intervention measures that have always been there? I wish to state that although social assistance in Namibia is old as its colonial past, based on historical ties to its former colonies, we know that Namibia was colonized by Germany, Britain, and South Africa. The landscape of social assistance took a different shape after Namibia independence, and especially in terms of the treatment of the beneficiaries, which was then made more, the access to this program increased because there was no discrimination, and the Constitution of Namibia mandated the equal treatment of all the beneficiaries, meaning that they must get the same amount, they must all qualify, same criteria is used. Whereas during apartheid, beneficiaries would receive
Can I give you 1 minute so that you wrap up? Sorry to disturb you.
Thank you. I'm busy wrapping up. I'm only having 3 lines to cover. Thanks you. So while the effort done by the state to counter the effect of COVID-19 were commendable, they fell short of meeting some of the basic minimum requirement of Convention 102 of the ILO regarding the level of support and duration thereof. So the stimulus was just for a mere 3 weeks. The 750 was only for 3 weeks, whereas the contingency lasted for over 6 months based on the state of emergency, which started in March to September last year. And as we are speaking now, there were still more lockdowns that we experienced. The 3 things that I wanted to conclude with, Chair, is the exclusion from participation of qualifying sectors were another shortcoming. There is a missing middle in terms of income earners who were left out, as I have explained. And then the design of the program was also done without the involvement of social partners. There was no consultation to say, this is the program. It was like top down, and then it has been implemented like that. It's now 2 years that the pandemic is around, but no additional measures are put in place to assist those impacted by the pandemic on a long-term basis. So all in all, this was quite a good venture. But going forward, I think we have learned quite a lot of lessons, and the paper is indicating the recommendations, what need to be done, so that if we are affected by either the 4th wave or by another pandemic, then you should be able to use the lessons learned from this research. I thank you, Chairperson.
Thanks, David, again. Let me quickly now go to Zakhe so that she can give us the responses from Eswatini. I think with you, Zakhe, I'll then pause to say, as you give us those responses, maybe can you speak to the successes and challenges in implementing these responses in Eswatini? Over to you.
Thank you very much. In Eswatini, I can just say that according to the research findings, under the 3 categories of social protection, we had a number of programs, like, in social assistance, for example, we had cash transfers and food distribution. Cash transfers were 750 rand per, well, it was once off. And then we had basic food parcels for the needy. We also had a relief fund for low-paid workers who were maybe retrenched during COVID-19, which was 450 rands per month. The old age grant, which was in existence, continued. Disability grant also was in existence. It continued during the COVID-19 with very minor changes. Orphans and vulnerable children, some of them got agriculture subsidy, like the child-headed households. And under social insurance, the government didn't really had much response. And that means that the employees, for example, those who were retrenched, had problems with cash. And we also have problems with those who were in isolation, who got COVID, and were in isolation for 2 weeks because they didn't have any means of survival, because the no work, no pay policy continued, and which means that you wouldn't be paid for the 2 weeks, but without any social insurance, then it means that you couldn't have any other means of survival. On the issue of access to social services, for example, under education, we had new programs like homeschooling. These were introduced. Distance learning was also introduced, mass media, and for the tertiary, we had e-learning programs that were supposed to be adopted because there were new programs and they were introduced so that children could continue in school. But then when we talk about implementation, moving to implementation, I would, and also include effectiveness of the programs, I would say that when you look at the situation on the ground, in terms of poverty, I can say that we're basically worse off. There is more violence against women and children, neglect of persons with disability, and also issues of unemployment for both the formal and informal sector. And here the youth are the most affected in terms of unemployment. So when you look at these programs, you can see that maybe at implementation, we are not really getting much out of the programs that were implemented. And when we, for example, when you look at the homeschooling program and the distance learning, we found that no research was actually done to find out whether the disadvantaged children would be able to access the resources that were needed for distance learning and for mass media. Some of them didn't have the radio, some of them didn't have the laptops. So basically they couldn't access this kind of programs. And maybe if we had had research to find out if they'll be able to, then it would have helped to see who would be assisted so that all the children would be able to access education at that point. So you can see that the vulnerable children were left behind even in the school programs that were introduced. So they still could not access education during COVID-19. And also, when you look at the social assistance programs, basically it was announced that with the cash transfers, everyone would receive, the needy people would receive 750 rands. And what happened when it was implemented, we found that those who were under any social grant, who were receiving any social grant, were excluded from this. So it means the elderly were excluded. Those who were receiving the elderly social grant were excluded. Those who were on disability grant were excluded. And some of those orphans and vulnerable children were excluded. So which basically means that a lot of the needy people were excluded. And the question is, who then received the cash transfers that the government said people were going to receive? So the issue of targeting now becomes, the question is targeting, who basically received this? So at implementation, things changed. It was no longer the needy, but some people were already excluded, and that is the most critical group, that is needy, that was excluded. When we also look at the relief fund for the low-paid workers, when we visited some companies to ask whether they've received the retrenchment packages. They said they haven't received the retrenchment packages. So which means really most of the workers who were retrenched didn't receive the grant that was put in place to assist them. And also the informal sector was excluded in any case, which means all of those who are in the informal sector, especially women, were basically excluded from this. So they didn't get any assistance. So that's why I'm saying that maybe the effectiveness of these programs, leaves much to be desired. So basically, I think that's what I can say in my 15 minutes. I hope I haven't exceeded.
Thank you so much, Zakhe. You kept on time, and thanks again for that. Now let me pass on the baton to Isaac, who joins us virtually. Isaac, your 7 minutes, please.
Thank you. Good morning to all the SASPEN conference attendees. Greetings from Lusaka, Zambia. My name is Dr. Isaac Kabelenga from the University of Zambia, and I was the country researcher for Zambia on this study. I was supposed to be there physically, but because of logistical challenges, I could not manage to do that. Hope to be there, God allowing, next year or so. So in the first place, I would like to give context in which I'm presenting these findings of the study. This study was actually undertaken for the period from 7th of January up to 28th January 2021. And this is the time when Zambia had recorded high numbers of COVID-19. So you have to understand that what I'm presenting here, they are representing the period before March 2020, when Zambia recorded the cases of COVID-19, and also for the period from March 2020 to January 2021. So there might be new things that have happened from January 2021 to date. So during this time, Zambia had actually recorded a number of COVID-19 cases. For example, the first 2 cases of COVID-19 were recorded on 18th March 2020. And at the time of submitting this research report on 28th January 2021, Zambia recorded 48,911 cases of COVID-19 with 41,282 recoveries and 688 deaths. So this means that the cases of COVID-19 were on the increase in Zambia from March 2020 up to the time of this study. And during this time, the government of Zambia did some partial lockdowns. For example, people were told to stay home and to stay safe, and there were some restrictions in doing things. And during this time around, there was a lot of actual vulnerability among the Zambian people, and the prices of goods went up, and generally the living standards of most of the people were quite high. And the government of Zambia, by then, during the former government, the Patriotic Front government, under the former president, Edgar Chagwa, they introduced a number of social protection programs. I'm sure you're all aware that government, Zambia now has a new government. Zambians went for the election on 12th August 2021, and now we have a new government. So what I'm presenting mainly, they fall under the old regime for the former president, Edgar Chagwa, and now we have the president under Hakainde Hichilema. Now, in Zambia, there is evidence from this study that even before COVID-19, Zambia had a number of social protection programs, and they were implemented under the 5 pillars, namely social assistance pillar, livelihood empowerment and empowerment pillar, and then we had social security and health insurance pillar, and then we had the protection pillar, and then we had also the disability pillar. However, with the emergence of COVID-19, there is evidence that all these programs they continued being implemented. However, the government of Zambia and the international and local cooperating partners, they introduced 3 major social protection interventions. And these are vertical expansion, 2 horizontal expansion, and alignment. When we say vertical expansion, it simply means that all the beneficiaries of social protection programs, especially the cash transfers, who were on that program before the emergence of COVID-19, they were all covered. They were all covered even during the COVID-19 pandemic. However, in addition to that, the government of Zambia also introduced what was called the horizontal expansion or social protection. So the horizontal expansion social protection just entailed that the government added new beneficiaries to the existing beneficiaries of social protection, and those were mainly people who became vulnerable because of COVID-19. So among them, they included, like, for example, the informal economy workers, the disabled people, orphaned children, older women, and women who were, for example, taking care of 3 or more children, and other persons, including people with disabilities. And on top of that, the government of Zambia also introduced what was called the alignment social protection. When we say alignment from this study, it was established that the government of Zambia introduced additional services to give to the people who were on vertical social protection and those who were on horizontal social protection. The additional services which were provided from this study, they included sensitizing the poor and the vulnerable people about the dangers of COVID-19, encouraging them to use hygienic practices which should prevent them from contracting other diseases. And they also provided with them with nutritious related foods and also the face masks. So that means that in the context of COVID-19, there is evidence that the government of Zambia had actually expanded or they broadened the coverage of social protection. And an interesting thing that this study has established was that this expansion of social protection took place amidst the serious economic challenges that the government of Zambia faced. The Zambian economy really in 2020, 2021 was really struggling. There was no economic activity. But despite that, the government of Zambia decided to expand the coverage of social protection. So from the findings of this study, it means that more money in Zambia has now gone into social protection, despite the fact that the Zambian economy has actually more or less like completely weakened, or there's almost non-economic activity which is taking place. So the findings of this study, therefore, raises the issue that in the expansion of social protection services, what matters is the political will. Where there is the political will, the financial, the physical space will always be found. I know that we are all social protection experts, and one of the excuses that a number of governments in SADC and the African region, what they give is the issue of physical space. And you all agree with me that most of the African countries, their economies have done poorly during COVID-19. But you find that in Zambia, despite that, the money to expand the coverage of social protection services were found. And interesting also is that this study established that the actual benefits or the social cash transfer benefits which were given actually were even increased by more than 2/3, I think by more than twice. The study established that before COVID-19, the beneficiaries were getting between 900 and 180 Zambian kwacha. But during COVID-19 pandemic, this amount was increased across all categories of beneficiaries to 400. So to those of you who are good at mathematics, you find that when you do your calculation, you find that the amount was doubled. So the question is, where did the money come from? Which means that money is somewhere. What was lacking in the past was political will. And during this COVID-19, political will was actually seen. And the study also established that this amount was also supposed to be given to the beneficiaries only for the period of 6 months. So because of that, you find that especially the people on the horizontal social protection, they were not expected to continue to receive the emergency social cash emergency COVID-19 social protection services after 6 months. And that in itself has a limitation in the sense that those beneficiaries, for example, who are worst affected by COVID-19, they will not have any social protection coverage after the elapse of the 6 months. And also in conclusion,
yes, 1 minute, thank you.
Thank you. In conclusion, it is evident that COVID-19 has shown the people of Zambia that social protection is an important developmental issue, is an important way to shield the poor and the vulnerable people. However, this study did not assess the impact of this emergency cash transfer on the beneficiaries. Thus, it's difficult to tell whether this 400 kwacha was sufficient to enable the beneficiaries sustain themselves during the 6 months. Thank you.
All right, thank you so much, Isaac. Let me quickly come to Mutale, and I think here, Mutale, if you can address like broader considerations, to connect all these responses in these 3 country cases that we have had, and probably what it means moving forward concerning the policy options.
Okay, thank you very much. I'll try and make it very quick because of time. I won't go into context and everything. I'll just speak directly to some of the broader considerations. I think the starting point for the different countries, so the study was done in 10 different countries, but I'll speak generally to the commonalities in the responses and the considerations that applied to the measures taken by the different countries. So I think to start with, one was because all the different countries when COVID hit needed to design a response in order to stop the spread of the virus, of course. And so that was a starting point. But then with that came its own implications because the containment measures, like lockdown measures or stay-home orders, meant that people were not able to earn a livelihood the way that they were able to before. It means that their income was cut and also access to services, of course, was limited. Now we're talking about a context such as the Southern African context, where access to social services was already limited even before the COVID pandemic hit. So in order to ensure that the containment measures were effective, countries decided to look at social protection as a response in order to allow people to stay home, but not necessarily lose out on their livelihoods as much as they would in the absence of social protection. So that was a starting point. Another consideration was also working with what was existing at the time. Most countries were leveraging existing programs. This has been mentioned also by Zakhe and Isaac from Eswatini and Zambia, where, for instance, programs that were pre-existing were either extended or continued. And so this was because they had to work with systems that were already in place. And this, in many cases, was very vital to the success of the response by the different countries. And one thing that was common across the countries, except for a few, that became very important to consider was where the countries were in terms of having shock responses, social protection programs. So there was a lot of thinking around making more resilient systems for social protection. And this obviously came with adjustments to programs. Like Isaac mentioned, we had in some countries vertical expansion, in other countries horizontal expansion, and also alignment in a number of cases to the existing programs. And then there was also a lot of efforts from NGOs in the different countries to support the government response. Other than that, another thing that emerged that was common across the countries was also the vulnerability descriptions. Previously, it was very distinct which the vulnerable groups were, which groups were poor, and things of that nature. But then with COVID, there were newly vulnerable groups that emerged in the different countries. And interestingly, these were very similar across the countries. And most of these were migrant workers, informal sector workers, and labor-constrained households. So we had households like persons with disabilities, we had women households with caring responsibilities. We had children and the elderly being the common descriptors in this case. So considering that, most of the countries designed very strategic responses in order to reach these vulnerable groups, whether they were newly vulnerable or they were pre-existing vulnerabilities before COVID struck. And so governments designed programs in order to reduce the vulnerability of these groups. And then also another major consideration was the need for economic rebounding. Like Isaac mentioned, also most countries' economies stagnated at best case scenario, but in most cases they actually contracted. And so countries had to think about how they bounce back after the measures were instituted. For instance, the IMF report suggested that in the SADC region, most countries were contracting at the rate of 3.5% or thereabout. And so they had to bounce back and from the recession and see how growth would look like in 2021. In most cases, it was expected that in 2021, there would be a rebound of most economies. They would do slightly better than they did in 2020. But unfortunately, because the third wave hit most countries in 2021, this projection is a bit more pessimistic in reality. And then finally, in that regard, there was a consideration around financing. I think it was Isaac that mentioned that financing was particularly a challenge. I think Zakhe also mentioned that. Most countries had to look around for where resources would be made available for the response. In some cases, countries did not have available resources. There are very few countries with a contingency buffer fund to finance social protection programs. So because of this lack of emergency funding framework, most countries struggled to make finances available. This is why it became important for different development partners and civil society organizations to partner with governments to help support the response in providing social protection. I think we're still a long way away from providing comprehensive social protection in most of these countries, but that's really an important direction to be heading for different countries in the SADC region. I think Marius is the one who mentioned earlier on in the morning that countries such as South Africa and Mauritius are much ahead, and therefore the response was more comprehensive. But some countries, a number of the countries that were in the study, struggled to provide a comprehensive response. So that's in terms of the broader considerations. Now, in terms of the emerging policy options for the SADC region, we like to think about them in terms of, and we did this study with the 10 country researchers and with Gifter's colleagues. What are the important options for migrants, for the informal economy, and for public health? So in terms of migrants, as a starting point, we know that migrants were very severely affected by the pandemic. Remittances reduced significantly across the countries. So it's important for governments to think about measures that will support migrants and also look at extension of coverage to migrants. And for SADC particularly, to look at portability of benefits, of social protection benefits. For the informal economy, I think the important things to think about are providing economic stimuli in order for them to continue to be active, and also accommodative monetary policies, as well as establishment of some sort of whether emergency or solidarity funds that they can tap into during times of crisis. For public health, I think one of the major things is to think about increased spending for the health sector in general, but then also invest heavily in universal health coverage, which doesn't deviate anyway in any case from the SDG goal. So it will be important for countries to think about expediting their investments into universal health coverage in order to promote equity and access. I think I'll stop there and invite questions and hand it back to Gift.
Wow, thanks, Mutale, for even saving a minute. Thanks for that. Perhaps for engagement, we could have 5 minutes. If there's anyone who wants to raise, some point of discussion, we could quickly do so now. I do not know if we have any. We've got one. Let me quickly put them. It's only one, right? Okay, great.
Online, I'm not so sure. I could be guided by Susan. If we have also, can I have the questions so that I see how many we have, if it's fine? You can go ahead.
Okay, thank you very much, Gift and your colleagues, for the wonderful reflections that you bring across and share. And so it's interesting to see how the dynamics of policy interventions, as well as the different interventions that different contexts are taking. So from me, it is really something that I found very exciting to reflect with. But my question goes to Dr. Isaac from, I think, Zambia. And it was very interesting to hear in his presentation, which is interesting as well, to see the increase in funding that came during the COVID time, and to see what was increased, even much more doubled than the previous amount that was given in terms of the cash transfer or the social grants. But my question is that, where is this money coming from? And reading from the recent reports that are coming from Zambia, the president talks about the increasing debt burden that is over $12.7 billion US. And my question, or something that I'm interested in knowing, is that, could this be the borrowed money that at the end of the day is increasing a big debt burden for the country? And in the long run, considering the political times that the country is in, from the previous government and now to HH's government, is that likelihood for financial sustainability for this, especially social protection? And what are his thoughts in that regard? Is this just a political move that was made by the former government to usher in the political times, or it is something that is more sustainable? So I'm really interested in picking his mind in the context of Zambia. Thank you.
Thank you so much. Right, I don't have any other hand coming. Oh, I do. We can have you going up there.
Good morning, everyone. Thank you to the panelists for the insightful discussion. My name is Denita Hingston, and my question also goes to Dr. Isaac. So you mentioned that political will is very important in terms of delivering quality social protection. And you said that recently Zambia has had a transition in power, and oftentimes in African leadership, when a new leader comes in charge or comes in place, they want to take on a different approach and try something in contrast to their predecessor. And you said the predecessor had the political will to commit to the social grant. So will there be a continuation in this program, or perhaps, what's your idea on that in terms of continuing this? Thank you.
Okay, thank you. I think now I can go online. Unfortunately, I don't have access to the questions, so I'm not necessarily discriminating you online, but I hope that the other presenters who are online can pick on the questions, and should it relate to them, I'll give them just 1 minute or less to conclude and cover those. I think for now, most questions have fallen on you, Isaac. Can you briefly respond to the financial sustainability and continuity of these programs?
Thank you for the good questions. I'll begin with the first question. Regarding financial sustainability, on the basis of the study that we did not go into exploring the sources of income which was used to finance the social protection programs in Zambia during COVID-19 pandemic. But all I know is that from Zambia's COVID-19 emergency response plan, that there were many players that came on board to support different social protection programs. As Mutale mentioned, I think there were involvement of the international donor community, like I think UN agencies, which include UNICEF, I think UK DFID, a number of international NGOs, if I call well, I think which include even Care International, and there were also a number of local civil society organizations. So I should think that the source of the monies came from different sources. And that in itself also raises the issues of sustainability of social protection program in Zambia. And I think that is one of the issues which is at the center stage of all the debates in Zambia. However, when you look, I think, at the national budget for Zambia, each year, I think the social protection sector is being, I think, valued to be one of the tools to eradicating extreme poverty in Zambia. So year in, year out, the government of Zambia and the cooperating partners, they support that. But the issues of whether that is sustainable or not, it was beyond the scope of this study. And then there was a question as to whether that was just a political move because we are heading towards the general elections, which was slated for 12th August 2021. Again, it was beyond the scope of this study. We did not go into those dynamics. So it's difficult for me to say that, no, it was a political move. It was not a political move. I'll not be able to give the answer to that question. And then for question 3, on as political will as a very important tool in delivering quality social protection services. And there was also a concern as to whether there will be continuation in the provision of social protection services with the new government. In my own view, and as a social protection expert, the answer is yes. Political will is key in the provision of quality social protection services. From social policy point of view and from public policy point of view, social protection, especially if it is a government program, is delivered by the government. If there is no commitment of the political party in power, you don't expect anything. And if there is a political commitment, you expect something. So I think, yes, there was a lot of political will, the government, a lot of international organizations, local organizations to come on board. So that was what to me, that was political will. And to me, that was commendable. And that is the approach which we think we should advocate to be adopted throughout all the SADC countries. We need political will to social protection provision. And then with regard to continuation of social protection programs with the coming of the new political party, I think looking at the inaugural speech of the new President Hakainde Hichilema, he promised that he will get committed to provision of social protection services. And I should think maybe in the next few weeks within this month of October, that the Minister of Finance will be able to present the first national budget under the new government. So it is on the basis of that, when the budget is presented, that will be able to assess as to whether there is still this political will to expand the coverage of social protection services. Thank you.
Thank you so much, Isaac. So David, I know you have access to the messages popping in there. Can I give you a minute to talk to those and sort of summarize some of the responses that you may give to them? You can unmute David if you heard me. All right. Yes, thank you. Go ahead.
Yeah, thanks, Doctor. The issues we are dealing with here are really quite interesting. As I said in the beginning, that we are living in extraordinary times. So each country have its own dynamics in terms of how they deal with this pandemic. But I think in SADC, I was impressed by looking at what Eswatini was doing. It looked like we're copying from one another. Namibia and Eswatini were doing the 750 is just a coincidence. Unfortunately, then some countries have a longer term measure in terms of dealing with the pandemic, others have a short term view. But the challenges remain the same in terms of fiscal ability to then fund all these programs. So that is why in the case of Namibia, we are also talking about borrowing, government, we're talking about borrowing. And in the end, what happened also, the money that was not used, you cannot say it's available. It looked like we're living on borrowed resources to fund these programs. So that is why the lessons we have learned is simply if we're able to build resilient systems so that in case of a pandemic, then one can go and tap in those resources that are already available instead of collecting resources from elsewhere. So this is how I would sum up our lessons that we have learned from the research project. Thank you, Doctor.
Thanks, David. I think, unfortunately, time is no longer on our side. I want the panelists to sort of conclude. And let me start with Zakhe, really briefly, from how we have seen the discussion going and your take.
Thank you. I think my concern would just be that with the discussion so far, it looks like the different countries are struggling on their own under SADC. And I was wondering if we could have programs that emanate from the SADC itself, so that countries at least could be, the individual countries could be sort of encouraged to take on some of these social protection programs, which can be seen to be effective, rather than doing it on an individual basis. And also that the fact that I can see that our countries are in their own way committed or maybe doing something around social protection already. And I don't know how we can be, in a way, assist in making sure that we improve on what is already in place, and also or add on in what is existing, so that we can see more improvements in these programs. Right. And also to sort of ensure the full protection and continuity of the vulnerable populations. Thank you.
Thank you so much, Mutale.
Yeah, I think my three main things to go away with that I think need emphasis moving forward are really, I think two of them pick up on what the questions that the colleagues asked. So I think one is systems thinking. We really need to move to a place where we're providing social protection comprehensively. We need to start thinking about systems in the region. The second one is domestic resource mobilization. I think the question around financing and sustainability will not be answered in the absence of having a solid domestic resource mobilization strategy. And we need to think about this as a region as well. I like the quote that was mentioned earlier in the morning by Thabo Mbeki, I think, that we need to start thinking as a region and providing for domestic resource mobilization. We're a resource-rich region, and this can be achieved. I remember back in the day, Taku and the SPY team were advocating for the basic income grant SADC-wide. And I think it's important to go back to that. And then lastly, around political will is ensuring legal frameworks for social protection, providing a legal basis for sustaining social protection provision.
Right.
Thank you.
Thanks, Mutale. So basically, almost all the countries that we covered, their announcements, towards covering people during COVID, and in a way, that's political will. But I think lack of implementation in some countries, or even exclusion, speaks to the issue of social accountability. So if governments have committed, who is bringing them into account, to take account of what they said and implement it? So in a way, the study also speaks to social accountability that is very important in social protection. And perhaps the role of CSOs could really come through in our countries to nudge the government a bit to say, you have made commitments, please fulfill those. I think with that, we can stop our panel, and thank you so much.